Hello, I'm Dr. Nurettin Noyan. I'm a plastic surgeon in Istanbul and I want to give you a brief information about the aesthetic operations in my clinic. Despite the upper eyelid surgery, lower eyelid surgery sometimes can be a very challenging operation. There are two techniques of the lower eyelid surgery, lower blepharoplasty. One is the external technique, the other is the internal technique. The most important difference between these techniques, if you want to remove excess skin on the lower eyelid, you have to make an external technique. But if the patient is young, if she or he has a firm skin, not lax skin, just only the problem is the bulging of the fatty cells. In the internal technique, we make an incision just internal part of the lower eyelid and try to take out the fat cells away from the inside out. In the external technique, first of all, we make an incision just 2 millimeters beneath the eyelashes. We raise the skin envelope as a flap, and then we take out fat cells away from outside, and then we take the excess skin upward and we take out the excess skin cut away, and we stitch the skin to its new place and we try to correct the muscles. In my hands, usually it takes 45 minutes operation. I usually prefer sedation anesthesia or the general anesthesia because, especially for the lower eyelid surgery, local anesthesia by alone is not a preferred technique. Patients can be a little bit frightened from that. We put some bandages over the eyelid. There can be some bruising, swelling, and the ectropion appearance, which shows the sclera, the white part of the eyes in the first early days. At the 7th day of the operation, if we use the external technique, we take out the stitches away and we begin massage over the eyelid with the lymphatic drainage direction, and we try to enhance the muscle strain ability after the operation. Sometimes the muscle can be a little bit paralyzed after this operation and shows the globe of the eye, and it can be sometimes annoying for the patients, but with the time, after weeks, with trying to make up some exercises and massages over the eyelid begins to take its new appearance. Sometimes it can take 6 to 12 weeks after the operation to see the final result, but it always must be examined, and it always must be evaluated with the mid-face of the face with the lower eyelid surgery.